an update to a KCRA3 investigation, a backlog of bodies accumulating after patients died at one Sacramento County hospital.
Yeah, our investigation uncovers the disturbing findings now from the state and federal regulators at Mercy San Juan Medical Center. We first told you in October the story of two mothers who said their adult children went to the hospital where they died and then went missing. The bodies of their loved ones were kept at an off-site morgue for a month or even a year in one case without the families ever knowing. And tonight, KCRA3 investigates Lizzie Mitri joins us with this bombshell report that basically exposes what may have been going on behind the scenes at that hospital for years, Lizzie.
Colson, over the last several months, we've revealed many cases of delayed death certificates linked to this hospital, and that often meant those patients' remains were kept for long periods of time at an off-site morgue. Now we're learning this is more than just a few cases. It's an issue that state regulators say the hospital has known about for years and did not fix. We want to warn you, some of these details may be tough to hear.
The mystery surrounding what's been going on inside this Carmichael hospital has been a source of stress and grief for months for these families.
Because nobody can explain to me what happened.
I knew something was wrong right away.
Two families who each reported a loved one missing and searched for them with the help of law enforcement, only to later learn they had died long ago here at Mercy San Juan Medical Center.
That whole time that we thought that she was alive.
They said the hospital never notified them, and there was no public record of the death yet because the hospital took so long to have a doctor sign a death certificate.
This is crazy to me.
But this goes beyond these two families left in limbo. A new report KCRA3 Investigates obtained reveals in October Mercy San Juan was accused of keeping the bodies of 61 patients at an off-site morgue. 19 kept there since the first half of 2024, 15 since 2023, and 11 kept there for about 2 years since 2022. We know the remains of at least 4 Mercy San Juan patients were kept here at cremations only. The California Department of Public Health, or CDPH, states during a survey for federal regulators, the Centers for Medicare and Medicaid Services, it found several deficiencies at this hospital. The hospital failed to ensure the services of the regional morgue office complied with regulations and facility policies and procedures related to family notification of patient death, timely completion of death certificates, and processing of patient remains. Failures, it says, contributed to the prolonged storage of bodies in an off-site morgue and family distress over the perception of patients missing. So how does this happen? The report states the hospital was responsible for making 3 attempts to contact family after a patient's death. But until recently, there was no log to track those attempts. If those attempts fail, the hospital is supposed to notify the county public administrator or the coroner, but the hospital could not provide documented evidence it ever did that. State regulators interviewed the hospital president. The hospital's website shows that's Michael Corpiel, seen here in a KCRA story from last year. The documents show in his CDPH interview, he said, quote, "We assumed the remains being stored did not have families," saying the hospital got a lot of patients who were homeless. The chief operating officer was also interviewed and told regulators he was not aware of the backlog of processing human remains until it made the news.
They claim they were led to believe their daughter was missing for a year.
He said then it became a priority. But the report highlights regulatory violations for similar issues dating back to at least 2022 when the hospital came up with a plan to fix them. It was supposed to educate staff on getting accurate family contact information, making timely notifications of death, and finishing medical charts on time. Based on this report, that plan failed.
Now remember, this hospital is owned by Dignity Health. Dignity is in the name, and yet in 2023, this report says the hospital drafted another plan highlighting the need to educate its staff on steps to take after patient's death that will ensure, quote, dignity and respect. Steps that the families we've spoken to did not feel were taken. We did reach out to Dignity Health and even the hospital president directly asking for an interview. Instead, they referred us back to the same prepared statement they emailed us back in September when we started covering this. They said in part they're reviewing the circumstances where there may have been delays in completing death certificates, and their goal is to provide the best support possible for patients and their families.
Yeah, and just to set up a better system of them recording all that. Lizzie, so what happens next in the when it comes to the state investigation?
After they report their statement of deficiencies that they find, then the hospital has 10 days to come up with a plan for how it's supposed to fix these problems. So we've requested that plan from state and federal health regulators, and so far they haven't sent it.
All right, we know you'll stay on top of it. Thank you, Lizzie.
Do you have a tip for KCRA 3 Investigates? Call 3 at 916-325-3344, or you can send us an email to KCRA3investigates@kcra.com. We'll look into your tip. Make sure to leave your contact information so we can get back to you.